Babies get a lot of colds and coughs in their first year. A baby's immune system hasn't yet learned how to fight off common viruses, and in fact, the only way to build up immunity is to come across each of those viruses in turn. There are about 200 cold viruses, so it's no surprise babies get so many colds. As a rough guide, it'll be 8 a year, so if you have twins, that's about 16 colds to cope with. And for that reason, winter can seem just one long cold. On average, each cold lasts just a few days, though it can linger for just over a week. Your babies may feel a bit unwell with a cold, and blocked nostrils can make it hard to feed. There could be a bit of a cough as well from the mucus that drips down the back of the throat. But in general, a baby with a cold isn't too ill, and if you think your baby's really poorly, it is more than just a cold. There are ways to help. Use only soft tissues or cotton wool to wipe runny noses. For a very blocked nose, you can ask your pharmacist about a decongestant cream or a rub that's suitable for that age group. And when your babies have colds, be patient with feeds and give them lots of time, whether it's breast or bottle. At night, they may find it easier to sleep with the head of the cot raised, but only if you can do so safely. And remember, please stick to the guidelines on preventing cot death. When to go to the GP or even A&E? Well, always keep a close eye on your babies because things can change quickly. Usually for the better, of course, but sometimes it's the other way. Most colds don't need the doctor, but always see your GP if one of your babies has trouble breathing, develops a high fever, is listless, off his feeds, has vomiting, diarrhea, an unexplained rash, or is crying and cannot be consoled. The younger your babies, the more urgently you should get medical attention. Go to A&E right away if a baby struggles to breathe, turns blue, or doesn't respond.